Hello everyone. We continue our discussion about antibacterials, and this is the last section regarding the inhibitors of cell wall synthesis. We already covered the beta-lactam antibiotics, start from penicillin, cephalosporin, carbamazepine, monabactam. Then we move to the other antibiotics. Here we have vancomycin, daptomycin, fosfomycin, polymyxin. We have bacitracin, cyclosporin. So we are going to discuss some of these antibiotics in more detail a little bit, but we are not going in depth with these antibiotics. If you need more information, I recommend you to go to the website. For example, you can type polymyxin prescribing information, and they give you the information from access data from the FDA about the complete set of information about the medication, start from the introduction to the conclusion to the drug mechanism of action, adverse effect, uses, spectrum, everything. Okay, as you can see from the slide here, this slide shows us the group of medication that affect the cell wall synthesis. So we call this group inhibitors of cell wall synthesis. We cover the beta-lactam antibiotic, penicillin, cephalosporin, carbamazepine, monabactam. We cover the beta-lactamase inhibitor, clavulanic acid, sulbactam, tazobactam, and we have another three new beta-lactamase inhibitors. We recommend you to go back and review it. A new three beta-lactamase inhibitor. Today we are going to speak about some of these other antibiotics such as vancomycin, fosfomycin, daptomycin, polymyxin, and bacitracin is like we use it for skin infection, like local effect for skin infection. Okay, so start with the first medication in this group, vancomycin. Vancomycin affect the peptidoglycan, inhibit the peptidoglycan, D-alanine peptidoglycan. Vancomycin considered like beta bactericidal by affecting the gram-positive bacteria, mainly work against the MRSA, MRSA, MRSA for epidermis, enterococcus, and Clostridium difficile. So for this one here, for Clostridium difficile, so we use the vancomycin oral here. So please remember, we have for this one here, for the severe infection with the gram-positive bacteria, vancomycin, we use vancomycin injectable. And for the Clostridium difficile, this one we talk about the GI system, gastrointestinal tract, we use vancomycin oral. So we have two types of vancomycin available in the practice. Okay, so vancomycin could be used for the skin and soft tissue infections, endocarditis, and nosocomial pneumonia. So vancomycin, we need to remember the mechanism of action: bactericidal, MRSA, MRSAE, Enterobacter, Clostridium difficile, and the main clinical therapeutic use. For the side effect or adverse effect, vancomycin may cause nephrotoxicity, may cause ototoxicity. Vancomycin may cause allergic reactions, and it is characterized by red man syndrome, which related to the allergic reaction. And so for the nephrotoxicity and ototoxicity, here we need to remember that we have some medication may cause nephrotoxicity and ototoxicity, such as aminoglycoside. We have the prototype gentamicin. Okay, we don't recommend to use this medication with vancomycin. We don't recommend to combine it because aminoglycoside cause nephrotoxicity and ototoxicity. Vancomycin cause nephrotoxicity, ototoxicity. This is maybe adjunctive side effects, synergistic effect of adverse drug reaction, and may aggravate the symptoms. For this reason, we don't recommend to use it together in order to avoid the nephrotoxicity and ototoxicity. So nephrotoxicity characterized by red man syndrome, and phlebitis. If you like to remember this side effect about vancomycin, for example, I have maybe some mnemonic for that. We have vancomycin, VAN. I will start from the end. N start for nephrotoxicity, A for the allergic, okay, and V for phlebitis. We'll talk about vein. So you can see here vein, inflammation, phlebitis, A allergic, and N for nephrotoxicity. Okay, so when you have the oral formulation, we use vancomycin oral to be local effect on the GI system for patients from Clostridium difficile infections. The case study here, we can maybe discuss the situation when you have patients, for example, suffer from infection due to the anaerobic bacteria. And you prescribe clindamycin to your patient, but this patient come back to the hospital after a few days or 1 week, suffer from severe diarrhea, and the diagnosis made patient to suffer from Clostridium difficile, or we call this one pseudomembranous colitis, severe diarrhea due to the pseudomembranous colitis, and this is caused by Clostridium difficile. So the treatment here for this case, when we have the patients are from Clostridium difficile, is not vancomycin. Vancomycin not first choice. The first choice will be for the pseudomonas membranous colitis will be metronidazole. Okay, the second choice will be vancomycin orally. So we have two choices here for the patients from Clostridium difficile or pseudomembranous colitis. We have metronidazole, then we have the vancomycin. Okay, here I would like to share the screen with you about vancomycin. You can see the vancomycin here. Okay, I click on this one here, vancomycin hydrochloride oral solution. This one for the Clostridium difficile. Okay, so what about the injection, for example, here? Okay, I will close this one, should be somewhere, injection. Okay, this is another image for the vancomycin injection. So we have vancomycin injection here for the patients from MRSA or MRSA epidermis, vancomycin injection. Okay, so we almost covered the vancomycin. We spoke about how this medication works. Is this medication cider or static? What type of bacteria will be covered by this antibiotic, or the clinical use of this antibiotic? And then we move to the side effect of vancomycin, and we have phlebitis, we have allergic reaction, red man syndrome, and then we have nephrotoxicity. Oral formulation available for patients from Clostridium difficile. Okay, the second medication and the other anti-inhibitor of cell wall, Fosfomycin. Fosfomycin considered like bactericidal, block cell wall synthesis, mainly used for urinary tract infection, considered like first-line treatment for acute cystitis. And the reason for that, because when you prescribe Fosfomycin, we have two formulations in the market. We have oral, we have injectable. This medication well distributed to the kidney, bladder, and prostate. For this reason, we use it for the patients suffer from acute infections of cystitis. When the patients suffer from bacterial cystitis, Fosfomycin the drug of choice, because this Fosfomycin distributed with a high concentration in the kidney, bladder, and prostate. Okay, so this medication prescribed once daily. We have some parenteral injection for the formulation for the systemic infections. I would like to share some screen with you here, some Google images for Fosfomycin. As you can see here, we have Fosfomycin oral. Okay, Fosfomycin granules oral solution. We have some Fosfomycin injectable. Okay, you can see the Fosfomycin injection. So fosfomycin available like injection and fosfomycin available like oral. When you speak about oral, we use it for urinary tract infection, especially for acute cystitis. And the reason because this medication excreted but with a high concentration in the urine, therefore considered like effective in treatment of urinary tract infection. Okay, the last one in the other inhibitor of cell wall synthesis, we have polymyxins. Polymyxins, we have polymyxin A, if we have polymyxin B and E. And we need to remember that polymyxin mainly cover the gram-negative bacteria, cause disruption in the cell membrane, and leaking of the content of the bacterial cells. And this is considered bactericidal. Okay, bactericidal activity against the list of bacteria: Pseudomonas, E. coli, Klebsiella, Acinetobacter, and Enterobacter. For the polymyxin, please remember the gram-negative cidal activity, list of or broad spectrum, concentration dependent. We covered that with in the beginning of in our introduction about antibacterial, and I recommend you to review that, what that means with the concentration dependent or time dependent. So polymyxin produce the concentration dependent. Okay, so we have two type of polymyxin. We have polymyxin B, and this available like parenteral, injectable. And we have it like ointment, eye solution, or like ears, drops, topical preparation. So we have it like ointment, we have it drops for eyes or ears drops, we have it injection. So polymyxin. Colistin or polymyxin E administered IV or inhaled via the nebulizer. Here we are talking about some cases like cystic fibrosis, COPD, some cases. This medication, polymyxin, increased risk of nephrotoxicity and neurotoxicity. We need to remember that. Nephrotoxicity, okay, we have, for example, we have some other medications such as vancomycin. Vancomycin cause nephrotoxicity. Aminoglycoside cause nephrotoxicity. Methicillin cause nephrotoxicity. All these medications, now we can add polymyxin. So we have list of medications. So the question, which of these antibiotic may cause nephrotoxicity? Vancomycin, aminoglycoside, methicillin, polymyxin. So from this slide here, we need to focus on two medication: polymyxin B, available parenteral, ophthalmic, or ear solution, ear drops, or topical ointment preparation, polymyxin B. Then we have colistin, polymyxin E, administered or colistin administered IV or inhaled via the nebulizer, but this medication may carry the risk of neurotoxicity and nephrotoxicity. For this reason, we prefer to use it as salvage therapy for the multi-drug resistance infection. Okay, here I share the screen with you with the eye drops belong to the polymyxin eye drops. You can see it here. If I click on one of these, for example, here, you can see polymyxin, and it's like combined with a trimethoprim. And we have another one, for example, here, okay, polymyxin, trimethoprim to increase the coverage of bacteria. Okay, again, with the polymyxin B with a trimethoprim. Okay, polymyxin. What about polymyxin E? We have it here. Polymyxin E, and this one for the colistin. This is a colistin. Okay, if you click on this one here, you can see colistin based activity. So we have it like, what is colistin? It's like polymyxin E, and colistin used for the patients suffer from, for example, COPD or cystic fibrosis, to treat the multi-drug resistance infections. The other medication we spoke about, vancomycin for polymyxin, daptomycin. Daptomycin considered also like bactericidal, present bactericidal activity, concentration dependent activity against the gram-positive, effective against MRSA and vancomycin resistant enterococci, and considered like alternative for vancomycin, lanzolid infection. So when you have Staphylococcus aureus, methicillin, Staphylococcus sensitive, if the bacteria developed MRSA, so we can go with the vancomycin. If the bacteria develop vancomycin resistant Staphylococcus aureus, we go with the lanzolid. If the bacteria developed, we can go with the daptomycin. Now we have the process to choose methicillin. For example, here we go with the methicillin, and then the alternative, we have it here. Okay, this medication available intravenous, and dose should be adjusted in patient with renal dysfunction. And this medication could be used for patients from complicated skin and skin culture infection. If the patient also suffers from bacteremia, this medication could be used for the treatment. Endocarditis, so bacteremia, endocarditis, think about daptomycin, and we have picture for the daptomycin injection. I will share the screen with you. So you can see the daptomycin injection here. Okay, daptomycin injection used for bacteremia, complicated skin infection, and endocarditis. So three clinical cases: bacteremia, infections, endocarditis, and complicated skin infection. And this medication effective against MRSA and vancomycin resistance and towards the enterococci. Okay, this concludes our first lecture or first chapter about inhibitors of cell wall synthesis. Talking about antibacterials, we have several groups in the beginning, and we cover the first chapters about antibiotic, which include the inhibitors of cell wall synthesis, and we cover all the topics regarding this issue. And we have some details. We recommend you to go and read the textbook, journals, article published regarding any other antibiotic, but we cover the most popular clinical use of antibacterial, started from penicillin, cephalosporin, vancomycin, daptomycin, polymyxin, all these medication. Also we spoke about the beta-lactamase inhibitor and combined with the penicillin, cephalosporin, or menabinom and monobactam. At the end of this lecture, I would like to thank you for your listening, attending this session, and have a great day, everyone.